I'm Dr. Peter Solberg, and I'm an internist at Dartmouth-Hitchcock. Today we're going to talk a little bit about the importance of patients and their family members understanding and knowing their medications very well. A patient's medication list is and the medications that they're taking is one of the key aspects of our care that we provide. And it's very important that your providers know exactly what medications you're taking and that list be up to date. It's also very important that the list include not just prescription medications, but also over-the-counter medications and even herbal supplements. Even though we at Dartmouth keep what we hope is an accurate, up-to-date list of your medications in the computer, the truth is that folks are always, doses change, people often see more than one provider, they have an adverse effect from a medication or they can't afford to get it. And so we often find when we review those lists that what a person is actually taking is different from what we have in the computer. So we know that you know best, and we want to make sure that you can share that information with us every time we see you. So in order for me to take good care of you as you come to see me in the hospital or in the clinic, I need to know exactly what you're taking. One of the major concerns that we have whenever we take care of folks is medication errors. Medication errors are a really big problem in our country. It turns out that in about 5% of all hospital admissions, some kind of major error happens with the medications that can really cause harm to patients. In fact, unfortunately, although we try to prevent this, it turns out that sometimes these medication errors can lead to death. So it's critically important that we get your meds right. I'm an inpatient physician, and almost every day when I'm admitting a patient to the hospital, I start to look down the list that we have recorded in the medical record, and either the patient or their loved one who's with them will say, "Oh, that medicine, no, we stopped that 2 weeks ago. That medicine was giving them a rash." And I'll say, "Oh, I'm glad I talked to you." Patients and physicians share responsibility for making sure that the list is up to date. We're the technical experts that can help to make sure that we don't make mistakes, but we need to know what you're actually taking in order to take good care of you. When we look at or ask you about your medication list, we're interested in the exact names of the medications that you're taking, but we also want to know the dose of that medication, and we want to know how often, what times of day you take the medicine. I think it's actually really important to write your medication list down. A lot of folks know their medicine so well they're able to recite them by heart, but especially when we're ill, when we're not feeling well, we don't necessarily remember everything. So in my book, having the list written down is the best way not to forget. And we always tell folks that if they share a copy with a loved one, so that if they are brought to the hospital, someone who we contact might be able to share the information as well. The advice we give to folks is that they should carry their medication list basically all the time. Certainly for any scheduled clinic appointment, but also any time that they would go to an emergency room or be admitted to the hospital. And as well when they're traveling, when they might see a medical provider without planning on it, to have that information available is tremendously important. When you're within the Dartmouth-Hitchcock system, we usually have access to your computer record, but there are a lot of places where that information isn't going to be available, and having it written down on a piece of paper can really help. In order to protect your safety, as a matter of policy, we're going to ask you about your medication list every time we see you, and we hope you don't find it burdensome. The idea is that because those lists really do change so frequently, we need to stay up to date. We need to make sure that we're current. So being prepared with your list so that you can share with us any changes that might have happened since the last time we saw you is tremendously helpful. Sometimes folks are on a lot of medications. They may have them written down on a piece of paper, but other times they actually bring us their bottles. And to be honest with you, that's not a bad solution either. It's important that the bottles be labeled, and we like to know which ones the person's actually taking versus the ones that they might have in their cabinet but they're not taking. But sure, if you can't carry a list, carrying the medications is also often very helpful. When you leave your doctor's office at Dartmouth-Hitchcock or when you're discharged from the hospital, we will always hand you a copy of your updated medication list. And if you don't get one, you should definitely ask for one. Most providers' offices where you go will also generate for you a copy of the list that they have. And we think it's a great idea for you to get those so that you know that they know what you're taking. Probably the best source of information about a given prescription is the person who prescribes it for you. So asking the doctor or the provider in the office about the medication makes sense. One can also ask their pharmacist. Pharmacists are often really a wealth of information, are very knowledgeable. A lot of folks like to get on the web, and there's a number of resources, some of which are listed on Dartmouth-Hitchcock's website. Resources like WebMD, and even the United States government's FDA website have a number of resources for looking up and getting more educated about your medications. When patients ask me how they can best prepare for a clinic visit or for hospitalization, I tell them that I think probably the most important thing is awareness of their medications. So that is what type of medication they're taking, what the dosage is, how frequently they take it. All those things are really important, and we will take better care of you if you're able to share that information with us.